Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. Okay, Margaret, tell me what's going on with your shoulder. What happened?
Well, I fell walking around the lake, and I tripped off the sidewalk and caught myself primarily with both hands, but primarily it seems like on the right side.
Okay, so you embrace
So
it
I
this
braced
way.
this way, and it flipped me over, and I was fine. And this happened last Wednesday. I was fine for the rest of the week, but then starting like Saturday or Sunday, I can feel my arm and my shoulder seizing up, and also a little bit.
Limitation in range of motion when you go backward.
Yes, probably so. Yeah.
So,
yes, definitely.
So when you failed, you landed on your hand and you twisted, but you did not hit your shoulder.
I don't think so.
Did you lose conscious?
Yeah,
did you
I did
have
not.
any blackout or anything?
I did not. No.
Okay.
No.
So when this happened, how much pain did you feel from 0 to 10, and where did you feel the pain?
I think I was stiff a little bit. I don't know. Maybe, I don't know, 3 or 4.
Okay.
I was walking with several women, so I think my embarrassment was I got up and I continued my walk.
Super wild.
Whether I was in pain or not, I was a little bit stiff on my buttocks, and
So did you hit your hip?
I must have. I don't know if it was my hip or my buttock, because my butt muscle is sore.
It's very sore. Okay. But you want to focus now on your shoulder?
Yes.
Okay. So what is difficult for you to do, and how much pain when you do the motion now?
Well, it's becoming a little bit more difficult to pull up my pants, and I would say the pain there is maybe
At worst, how much?
3, 4.
Okay, where do you feel it?
But right back here.
In your
But
shoulder?
if I go to put my
Backwards?
bra on, and you add the stress of pulling the bra strap, it's like 8 or 9, and difficult to actually fasten it.
So reaching backward is very challenging for you since this happened.
Yes.
Before that, you were
Yes.
like, your shoulder was fine. And what about upward? How much pain?
So this is probably 7, 8.
Okay. So we're gonna.
And I feel it
here. Sharp dull aching. How you describe it?
Sharp.
Sharp pain. Okay. So we're gonna do some range of motion, and I want you to tell me from 0 to 10 how much pain. Okay. We're gonna do both sides so we can compare between both of them. Okay.
Okay.
So both arms go backward like this. Okay. So definitely you're limited a little bit, and
Right.
and you tell me how much pain.
I'd say 7, 8.
Okay, thumb up here. And look back. Yep. And bring it up. How much pain?
I'd say 8, 9.
So definitely a little bit limited here.
Yes.
8, 9. And where do you feel it?
And I feel it.
The same area?
Right.
Okay.
Right in here.
Okay, let's stand up. We'll turn around, and I want you to bring your arms backward both sides. So this way we can see. So that's your right side. It's limited here, and you are right-handed.
I am
So
right-handed.
this arm used to go up to here, the
Yes.
same level
Yes.
here.
Yes.
Okay, all right. How much pain with that?
Oh, 9, 10.
Okay, you're able to go a little bit, but
I
you
am,
push
but
it.
it's-
Don't
but
push
it's-
the pain.
yeah.
Okay. So I will assume no pain as long as you're not seeing anything. Okay. So let's bring your arm back and stop when you feel pain.
Right there.
How much from 0 to 10?
7, 8.
7, 8, and your range of motion here is 145. Okay. I'm gonna write these numbers down. Normal should be 180. So palm up here, and let's bring it toward your ear all the way this way. Stop when you feel pain. And this range of motion is okay. It's 155. 155 here, right in here. Okay. That
That's
should.
8, I would say.
That's 8 out of 10 pain.
Yes, yes. And I feel it right here.
You feel it right there. So we'll have your arm here this way, okay? So bring it down this way. So this is normal. I don't need to measure it. Bring it back this way. Just a little bit limited here, not too bad. Okay. And this one is, it's at 174. That's not bad. 66. Sorry. You can relax. External rotation 66. It should be 70 to 90. Okay. You feel this knot? That's a scar tissue. Okay. Make sure what I'm doing is not painful.
Okay.
How's that feel?
Not painful.
And you said you had bruises in your knee?
Not on my knee. Well, I have a couple bruises on my knee, but from the fall, it's further down on my neck, my shin.
Oh.
Because I didn't fall on my knees.
You fell like forward?
This time.
Oh. What?
I didn't fall on my knees.
Okay, so it was another fall. You fell before?
I fell off a bicycle.
When?
Oh, 2 months ago.
2 months ago?
Mm-hmm.
Okay. And where did you land it?
On my knees.
On your knees, forward? Did you hit your head?
No.
Mm-hmm. Okay. You wore a helmet, yeah?
Yeah, I know.
Okay.
It was just a recreational bike.
Oh, okay.
And I went to,
Mm-hmm.
it looked like a car wasn't going to stop.
Mm-hmm.
So I stopped, but lost my balance on the bike and
Oh.
fell off.
Well, you did not injure anything else?
Mm-mm.
Okay. Well, you're lucky that you're okay. Mm-hmm.
No broken bones.
That's good. Yeah. Don't break anything. And you sit here in your neck. Yeah?
Yes.
Okay, so we'll have you lift your head up and relax. Okay, so I'm gonna go deep here. So you had,
Arms.
am I remember right? Did you have frozen shoulder or something like
Yes,
that? Okay.
I did, exactly.
Yeah. Mm-hmm.
And you were fabulous.
Mm-hmm.
It was just
How long did I see you? The
I
time?
think, I want to say
Mm-hmm.
7-8 weeks.
7-8 weeks. Frozen shoulder. Now when I implement nutrition and the new tools, I discharge frozen shoulder patient in 3 visits. 7 weeks, that's not bad actually. Because typically, with traditional approaches that I used to use, like I learned in the school, usually frozen shoulder is 4 to 6 months. You feel this knot here?
Yes,
Mm-hmm.
that I do feel.
Mm-hmm. Is that painful what I'm doing or it's okay?
It's a little painful.
Make sure you tell me, okay?
Okay.
Make sure it's pain-free because I don't want to cause inflammation. If you feel pain, that could cause more inflammation.
Yeah.
It's like, you know, when you have an open wound, do you want to rub it?
No.
Because it's going to inflame it more. The same thing, we don't want to really irritate area that's inflamed. If you don't have inflammation, this pressure should be nothing, okay?
That's good.
Okay. But I feel like really deep knot here. You feel this one here? Okay. And this happened after this fall. It's not like,
Right,
okay.
because I was perfect. I had,
Mm-hmm. So since we worked on it like around like 7, 8, do you work out?
semi,
Mm-hmm.
not so regular.
What do you do?
I'm out of commission in terms of,
Mm-hmm.
I'm trying to find,
Mm-hmm.
after Bill's passing,
Oh, sorry about
you know,
that.
it's
Yeah.
just hard to get back into.
To a routine.
Yes.
Yeah. Well, go for a walk. It's a
But,
good,
yes,
healthy way of, just get outside.
I walk the lake 3 times a week with
Nice.
my friends,
yeah.
and I walk every day actually
Okay.
around the block. And
Just walk with the different friends that does not push you off the
Yeah.
the curb. I'm just joking.
I know.
Hopefully they're not watching this video.
yeah.
Yeah. Yeah, it was an accident.
It was
wasn't
a total
yeah,
accident.
Yeah,
Yes.
yeah. So. But overall, your balance is okay. It's not like
No, right.
you fall all
No,
the time or
no.
anything like that. Feel this big bump here? That's big scar tissue here. You feel this hardness? Your muscle should be feeling soft like this. Okay. Is that too much in here?
No.
Okay. You see, that's exact pressure that I applied here. But because you don't have inflammation here, it feels fine.
Wow.
You know what I mean? Because you have a little bit inflammation here, it's sensitive. That's why we don't want to really inflame it more. So you did not see this tool 5 years, like 8 years ago.
No.
This is a new one that's to work deep. So you had those tools.
I love your tools. I use them all the time.
Yeah. It's easy to use.
Yes.
Yeah.
Yes.
So you have this tool at home.
Yes.
You have the small one too? Or just this one and
I think I have the small one and that one.
this one?
Or
Yeah.
the medium. Maybe.
Mhm.
Did you have a medium size?
Yeah.
I don't think we went for the large one. I think we went for the medium one.
This one?
Um,
Or you had the
no,
old
we
design?
have this one. I'm talking about this. Other
This is
one.
a new
Oh no, the
one.
other one. The stick one. This one.
That's what you have?
The medium one. Do you have a medium one size? Or just large and small?
Large and small, like when I
Yes, sir.
manufactured.
Okay.
Yeah. When I was doing it like in the basement, I had several sizes, but I narrowed down to 2 sizes, just so it will not be too expensive to have too many tools. I redesigned it to make one design that work in,
For everybody.
well, like the curvature here, so you can use it in really big area, like here, wide area, your hamstring, your quads, your hamstring, your back, because it's wide area, and your arm, you have a small area here, you can use this one too. And if for really small, tiny area that you need to really have better control, you can use this part. So this way, one size actually could almost fit all. Does that make sense?
It does.
So that's why,
Good thinking on your part.
yeah, it just because initially when I did the prototype, I was like, oh my gosh, it's expensive even to manufacture so many tools. So, and that's why I had like really the good big size to cover most of the part, and this just to work in a delicate area if we're working in TMJ or headaches or something like that, so I have a little bit more better control. But for patient, like the program I have for patients, usually we give them this one because this is just gonna cover the entire body. It's easy to use, it's faster.
And that reminds me, you worked on my TMG too.
I did? Yeah, how's that?
Or well, it was.
Headache or TMG?
Well, I want to say TMG, but it's when what is it when you clasp your teeth?
Clench, yeah,
clench
you
your
had
teeth.
TMG, yeah. How was that?
It was great.
How many sessions we worked on that? It was the same time working on the shoulder
I think
and
it was the same time.
yeah, at the same time. And you okay? Okay. So I'm gonna use a lotion. It's gonna feel cold, okay? So I'm gonna show you the scar tissue, and you probably felt it. Okay. Okay, you feel this bump here?
Yes.
That's the scar tissue. You feel that? Okay. Is that painful? It's okay.
It's okay.
It's okay. Alright. And
I'll
back.
bring it back.
How is that?
Oh, I feel like I'm going back further.
Okay.
And
Any
it's
pain or
not-
it's
It's like a 3-4.
where do you
It's
feel
not like right here.
it? In the joint or outside?
No, in the muscle.
right in there?
Yes.
Okay, let's do the side. So I have a new tool actually work on inflammation. I did not use it yet to make sure, because I want to know, do you have inflammation or you don't have inflammation, you're purely stuck in a proliferation stage. That's why I did not use it, and I'm going to use it now because you have a little bit inflammation. Let's bring it back. How's that? Definitely going further.
I'm going further, right.
Still feel pain, or it's...
Right. It's 4 or 5, I think, rather than the 7, 8, or 9 that I had.
Okay, so went down a little bit. Let's go stand up, and we'll bring your arms backward. Turn around.
Yeah, I'm still restricted. Maybe even more so now.
Mm-hmm. And you feel it where? In
And
the
I
same
feel
area?
it, yes.
Okay, so we'll have you lie down. Okay, we'll have you sit up and drink some water and tell me how they will bring it back like this. How's that?
Okay.
Any difference after the Magna Heal?
Yes,
0
I
to 10?
think so.
Mm-hmm.
2?
Yeah, so went down a little bit. Where do you feel?
Muscle.
Right in the top. Okay.
Muscle.
Let's do the side. And up. How's that?
Wow.
That's almost normal, yeah.
Yeah, it's
Yeah.
good.
Good. Okay,
You
let's-
know, it's still, it's like a 3, and then again, it's the,
on that area?
like, yeah, on both sides.
Both sides, like this?
Like, right in here.
In here?
Mhm.
Okay. Alright, so relax. Some patient who has mild or moderate inflammation usually have it at home, and they strap it in the area just for a few hours. It depends on how much inflammation they have. So I'm gonna do it for another like few seconds, see how you feel. If not, we'll just have you do the range of motion while we strap it in. And we're gonna do the 2 range of motion again. The front, tell me how's that?
Mm-hmm.
Pain or it's gone?
No, it's still there.
0 to 10?
2,
Okay.
and I feel it here and back here.
Okay, let's do the side and up.
Wow,
How's that?
it's very good.
Yeah, I'm glad you did not wait very long, because if you wait, it might end up with a frozen shoulder like the other one.
Right.
Let's stand up and turn around, and I'll have you go backward. How's that?
Oh, much better.
That's a good range of motion here.
Yes.
You did not think about it, you just
No,
moved.
I just did it, whereas
Yeah.
a minute ago I couldn't do it.
So okay, let's lower your arm down, just leave the magnet there and try to lift your arm up and see if that make a change with the magnet. How's that?
Yeah.
You're going further.
Mm-hmm.
Go back and forth and see. So with
It hurts. You know, I can feel
how
the,
much?
I can feel
and
the
where?
strain right where I'm holding this.
Okay. So have you had any head trauma or falls or accidents? You hit your head?
No.
Mhm. Is it too much here? Or it's okay.
No, it's good.
So what happened is when you fail and you just
Mm-hmm.
push this way, that transition all the force
Mm-hmm.
to your shoulder and actually jammed your shoulder in, so you strain. So that the impact, you choked all the impact here.
Mm-hmm.
Well, you're lucky you did not hit your head,
Mm-hmm.
you know. So, and you probably felt it a day later, is that correct?
Probably 2 days later.
2 days. That's very typical. 1 to 2 days you'll feel it there. Is that too much?
And
or
then
is it
by Thursday, Friday, I can feel it
okay? Uh-huh.
getting stronger.
Yeah. Well, and when I tested you before the video, you had really muscle weakness. So I will not be surprised if you have a minor strain. But our goal is actually, instead of it's taking 4-6 weeks to really get the strain healed, to really finish it very quickly in just hopefully a week. Um, but the challenge is if someone has the same injury, like what happened before, you injure your shoulder, but you did not have intervention and you stop moving, you start to have frozen shoulder and you're not able to move it, and that's make it more intense treatment. Then just as soon as this happen, let's just take care of it. How much range of motion we can get today. If you still have a little bit pain, that's a sign you have like just a minor strain. Okay, so we need to be gentle, take it easy next few days so it will heal faster. Okay.
So is that like on the same pretense of, remember that when the magnetic bracelets were popular and?
Yes, it's not the same because before I came up with this magnet, I really did a lot of testing for a lot of stuff in the market. The issue I had with the magnet in the market, there's several issues. One is the magnetic force is extremely low, that does not penetrate the body to cause physiological changes. The other issue that they don't use a good magnet that's wear out over time. This is a permanent magnet. Okay. The third issue is they use carcinogenic ingredients as part of the coating. So I had to really like be specific with the manufacturer to really do specific coating that's not carcinogenic, because the standardized that they use nickel and they use other carcinogenic coating that you don't want to be on, you don't want to have it on your skin. So, and when I did the testing, the length of the magnetic field is extremely minor, so it's not gonna really touch the area that has the, so and if the magnetic field does not go deep enough, you're really not gonna, you're not reaching it, you know.
And didn't, I remember having done, is it PFF or
PMF, that's a machine,
PMF.
that's a pulse electromagnetic.
Magnetic, yeah.
Yeah, so I tried to invent something that's more cheaper, so patient can afford it and they can use it on a daily basis. So that's why I experiment with the magnet, and I designed this magnets because patient can afford to have it at home and use it as much as they want in all different body part, even walk with it. You know, I have patient with the stenosis, knee issues, bone on bone, and they can walk with it and be comfortable. You know, headaches or anything like that? Yes, no.
I generally don't get that, but maybe, I don't know if it's sinus or...
Where do you feel it?
Here.
In the sides? You start to clench again because of stress?
Probably.
Yeah. Yeah, just make sure you follow
no
the
stress
instruction.
in my life, right?
We all stress out. Life is, there's a stress always, you know. So, okay. Make sure what I'm doing is not painful, okay? Do you feel anything behind your eyes?
Yeah.
Yeah. Okay. You feel a little tightness here in your fascia? Okay. In here? You need to work on your back. Next. Is it too much? forward, flexion, okay. How's that?
Wow.
Back to normal, still feel a little bit discomfort.
It's still a little minor discomfort.
0 to 10, how much?
1, 2.
Okay, where do you feel it? So you felt better after working in your head?
Yes.
You see, it's in your
Yes.
head. I'm just joking. That's what usually doctor says. You have nothing, there's nothing wrong with you, it's
No,
in
it's
your
in
head.
your-
I'm like,
It's,
am I coming here because of that?
yes.
Come up and bring it up.
Wow, this is big difference.
Okay. So your fascia on your head restricted your range of motion.
Wow.
Okay, so let me actually, I want to do, because I like to get to 0 actually. So let's, we'll have you have time out again. Sorry. Just sit facing the wall.
Yes.
Okay, to work on the back, again, release your
Oh,
fascia on
yes.
the back.
Oh,
Okay. That's, it's very rewarding when, you know, working with patient and see them like years later, and you can see that they actually doing their homework, you know, correcting, like they learn and maintain what they learn, you know, correcting the posture and the behavior that causing the issue. Is it too much or it's
No,
okay?
it's okay.
Okay. So thumb up and let's bring it back. How's that?
Oh my gosh.
0 to 10?
0.5.
Not bad. I'm happy with that. It's better than 7 and 8.5. That's not bad. What about now?
Wow.
You're definitely moving a lot faster.
Yes.
Okay.
Yes.
So flexion was 145. Look at you. Okay. So now is it's 168. Okay. Almost there. We still a little bit have work to do.
Wow.
168. Okay. Abduction was 155. Let's bring it back toward your ear. Okay. So that was 155. Now it's actually 170. It's here, right here, 170. 70, no. It was 66, not 1. 66 now is 70. 76. 76. It's about 10 degrees.
Wow. That's
Okay.
amazing.
You can have a
They
seat.
improved it.
Yeah. So, all right. So, what do you think about ASTR treatment?
I love the ASTR.
Yeah. Can you tell the difference?
Yes, I definitely can.
Yeah.
It's amazing. It's
Yeah.
amazing. I feel so much better.
You're moving faster now.
Mhm.